Have you been broken up with for quite some time, but it feels like it just happened? Are you constantly overwhelmed with thoughts or feelings about your ex that you can't really focus on anything else? Keep watching to find out why and what you can do about it. For the best breakup advice from a counselor, subscribe to my channel and hit the bell to get notified of new videos every week. If you're having a hard time moving on from your breakup and don't know why, you might be experiencing complicated grief. It's important to understand what it is and what you need to do, and that's what you'll learn in this video. What is complicated grief? Typically, if a person experiences grief, they can recover. However, the person with complicated grief will continue to have symptoms. These symptoms can become overwhelming and begin to influence everyday life. Some common symptoms include feelings of numbness and detachment, inability to think about the loss with any positive memories, intense sorrow or pain because of the loss of your loved one, an inability to focus on anything but the loved one, extreme focus on things that remind one of the lost loved ones. Additional signs that you are experiencing complicated grief include feeling the need to isolate from others, having trouble carrying out normal routines, and experiencing depression or self-blame. Make sure to stick around to the end of the video because I'm going to talk about proven treatments that can help with complicated grief. Who experiences complicated grief? That depends on who you are, your psychological makeup, your support systems, and the meaning behind this experience. Complicated grief can come from a breakup, a loss of a pet, death of a friend or family member, or any kind of grieving. Processing complicated grief. Number 1, acknowledge your feelings. It's okay to hurt, it's okay to cry, and it's even okay to be angry. Acknowledging your feelings is the first step in taking control and healing. Number 2, understand that there is no normal way to grieve. No two people grieve the same way. You don't have to try to fit your grief or your emotions into a cookie-cutter mold. Take your time, as much time as you need. Number 3, recognize the difference between depression and grief. Depression is a common medical illness that negatively affects how a person feels, thinks, and acts. It may be present before a loss that causes grief, or becomes apparent after a loss. Depression may get worse after a loss. Grief, on the other hand, is a deep sorrow that is brought about by a significant loss or change. If you believe that you are experiencing depression, make sure to speak with a qualified professional, such as a psychologist or a psychiatrist. Number 4, take care of yourself. Your physical health has a huge impact on your emotional health. Make sure you schedule enough time to rest each night. Lack of sleep can cause overstimulation in the brain, which leads to increased anxiety and can trigger worsening grief and depression. Go for a walk or try an at-home workout. Eat nutritious meals so that your body can be healthy from the inside out. Try not to consume too much alcohol. Alcohol is a depressant and it will make you feel worse. Number 6, seek support. Whether it be from trusted friends, family, or a counselor, seeking support is crucial. When should you see a counselor? Anytime, really. They're trained professionals who can help you process this difficult time on a deeper level that friends and family members aren't qualified to help with. Some effective treatments for complicated grief include CBT, which is cognitive behavioral therapy, exposure therapy, and meaning therapy. So you can try to find a counselor who can specialize in one of these treatments and see which is the best fit for you. Not too sure who to hire for professional help? Watch my video here for tips and important questions to ask before you book an appointment. What is your biggest takeaway from this video? Leave your comment below. If you found this video helpful, make sure to like this video and subscribe to receive more helpful advice. Thank you so much for watching, and I look forward to seeing you in the next one. Until then, be kind and love yourself.